Hello everyone. So in this video I am going to explain you about the non-Hodgkin lymphoma. So non-Hodgkin lymphoma involve the B cell, B non-Hodgkin lymphoma, and all the other is T non-Hodgkin lymphoma. B and T cells both are involved in non-Hodgkin lymphoma. While in the Hodgkin lymphoma only B cells, the origin is only from the B cells. But here in the non-Hodgkin lymphoma, B and T both are cells are present, both types are present. So basically in the non-Hodgkin lymphoma we have the history given in this the non-Hodgkin lymphoma. Basically the mesenteric lymph node and Volder's rings were involving in the non-Hodgkin lymphoma. Please remember it that in the clinical case of the non-Hodgkin lymphoma, in the history mesenteric lymph node or the Volder's rings were present. So let's in this video I am going to explain about the B non-Hodgkin lymphoma. So first I want to tell you about the basically the B non-Hodgkin lymphoma were of 7 types. They were of 7 types. So B non-Hodgkin lymphoma were of 7 types. So first one I am going to tell you about the follicular lymphoma. First one is the follicular lymphoma. Second one is the DLBCL, diffused large B cell lymphoma, that is diffused large B cell lymphoma. And the third one, that is of Burkitt lymphoma. Please remember it that the third one is the Burkitt lymphoma. So in these three, one thing is common. So what is the common thing? That these three were originate from the germinal center. So origin from germinal center of the lymph node. So all these three were originate from the germinal center of the lymph node. And in all these three we have the common marker, that is CD19 positive and CD20 positive. So these two markers were common for all these three type of non-Hodgkin lymphoma, B type of non-Hodgkin lymphoma. CD19 and CD20 markers were positive in follicular lymphoma, DLBCL and Burkitt lymphoma. And these three were origin from the germinal centers of the lymph node. So in the worldwide, the most common non-Hodgkin lymphoma is the DLBCL. Please remember it that it is the most common non-Hodgkin lymphoma worldwide. So worldwide, the most common non-Hodgkin lymphoma is DLBCL. Please remember this question also. It is very, very important. Now, in the follicular lymphoma, what we see, so in the follicular lymphoma, we have the translocation, that is translocation 14:18. Translocation 14:18. And here there is increase of the anti-apoptotic factor, that is BCL2. Please remember it that here the increase in BCL2, and BCL2 is a anti-apoptotic factor. It gets increased. And here the CD markers were, first one is the CD19 positive, as I already told you, CD20 positive. But here one marker is also present, that here is BCL2 is there. BCL2 is there, and follicular lymphoma has good prognosis. Please remember it that the follicular lymphoma has good prognosis. So follicular lymphoma has good prognosis. Please remember it that the follicular lymphoma has the good prognosis. Now the worst prognosis is given, the bad prognosis is given by the diffuse large B cell lymphoma. It is also the most common, and also it gives the bad prognosis. And here the markers for diffuse large B cells were CD19, CD20, and here one special marker, that is BCL6, that is BCL6. Please remember it. BCL6 is, if in the question, in the clinical case, in the markers, if it is given that BCL6 is present, then it means that the question is about the DLBCL. And if there is BCL2, then the question is about follicular lymphoma. For the Burkitt lymphoma, we have that in this we see the CMYC mutation, CMYC mutation is seen there, and it is found in mostly in the endemic Africa. It is endemic Africa. And the most common site for the Burkitt lymphoma. So here I am going to explain about the Burkitt lymphoma. So about the Burkitt lymphoma. So the Burkitt lymphoma is the most common site for the Burkitt lymphoma is jaw swelling. Please remember it that the jaw swelling is the most common site for the Burkitt lymphoma. Please remember it. It is very important question that the jaw swelling is seen in the Burkitt lymphoma and it is mostly found in the endemic Africa, and it is associated with, please remember it, that it is associated with Epstein-Barr virus. And also in the Burkitt lymphoma, on the microscopic image, what we see the starry sky pattern. Please remember it that the starry sky appearance is seen in the Burkitt lymphoma. And for the markers of the Burkitt lymphoma, the markers for Burkitt lymphoma is CD19, CD20, and one more marker, that is Ki67 is 100%, approximate 100% Ki67 is there. Please remember it. This is very important question that Ki67 100% is seen in the Burkitt lymphoma. Please remember it. It is very important question, and here we see the starry sky appearance in the Burkitt lymphoma. This is also very important questions. And in the Burkitt lymphoma, the most common site is jaw swelling. So all these were very highlighted points which I am telling you. And here the mutation which we see in the Burkitt lymphoma. So Burkitt means Burkitt. So the mother gave the child Ashirvad like Burkitt. So here the child is around the 8 and 8:14 translocation is there in the Burkitt lymphoma. So now in this microscopic image, what we see? So in the microscopic image, we see that these stars these stars were macrophage. So these stars were macrophage. So these stars were macrophage, and the background, that is blue one which we see here. So this background is sky, and sky represents the tumor cells. Sky represent the tumor cells. Please remember it. This is also question which asked in the previous year questions, that what does the star represent and what does the sky represent. So the star represent the macrophage while the sky represent the tumor cells. So please remember it. It is also very important question. Now next move to the fourth type of the B non-Hodgkin lymphoma, B type non-Hodgkin lymphoma. So the fourth type, B type non-Hodgkin lymphoma, is CLL, or we can say SLL, that is small lymphocytic leukemia. Small lymphocytic lymphoma. Lymphocytic lymphoma. So what we see in this, so in the CLL, or I can say SLL, the deletion is 13q. So the deletion is 13q, and here the marker CD5 positive and it is CD23 positive. Both were positive. CD5 and CD23 is positive in the CLL and SLL, and here we see the deletion of 13q. And next one, the fifth B type non-Hodgkin lymphoma is, so the fifth type non-Hodgkin lymphoma is mantle cell lymphoma, that is mantle cell lymphoma. So in the mantle cell lymphoma, we see there is cyclin D1 mutation. There is cyclin D mutation is seen. So in the mantle cell lymphoma, we find the cyclin D mutation. Please remember it. It is important question. And also we see the translocation 11:18. And here the markers were found CD5 positive and CD23 negative. Please remember it. Here CD5 is positive and CD23 is negative. While in the CLL and SLL, both CD5 and CD23 markers were present. While in the mantle cell lymphoma, only the CD5 marker is present and CD23 marker is negative. And in the mantle cell lymphoma, we find the cyclin D1 mutation. So cyclin D mutation is seen in mantle cell lymphoma. Here the translocation is 11:18. And the marker is CD5 positive, CD23 negative. Now next, the sixth type of the non-Hodgkin lymphoma is marginal zone lymphoma, that is marginal zone lymphoma. So in the marginal zone lymphoma, here first we have to know that it is also known as maltoma. Please remember it, that it is also known as maltoma. It is very important question, and in this we see the translocation 11:18. We see the translocation 11:18, and here we find both markers were negative, CD5 negative and CD23 negative. Both markers are negative in the marginal zone lymphoma, or we can say in the maltoma. So please remember that these translocations and these markers were very important. Markers and translocations were very important about the B type of non-Hodgkin lymphoma. Now move to the last type of non-Hodgkin lymphoma, that is hairy cell leukemia. That is hairy cell leukemia. In the B type of non-Hodgkin lymphoma, all others were lymphoma, but the 7th type of the B type non-Hodgkin lymphoma, the name is hairy cell leukemia. Please remember it, it is leukemia. So for the hairy cell leukemia, we have very important questions. So here my first question, that it mostly involve the gender, that is male. So mostly involve the male. So most common it is found in the boys. So most common it is found in the boys. And here the mutation which we see in the hairy cell leukemia, please remember it, that it is very important question about the mutation is seen in hairy cell leukemia. The mutation is BRAF mutation, BRAF mutation, BRAF V600E. This is full mutation, but please remember in the short that it is BRAF mutation is seen in the hairy cell leukemia. My third question is that in the spleen what findings were seen. So in the spleen there is increase in the size of the spleen, that is splenomegaly is seen. That is splenomegaly is seen in the hairy cell leukemia. Now the fourth question, that is what is the special stain used for the hairy cell leukemia. So the special stain used for hairy cell leukemia is TRAB, that is tartrate resistance, that is tartrate resistance acid phosphatase. Tartrate resistance acid phosphatase is used for the hairy cell leukemia. In short, we can remember it like TRAB mutation is seen. And the markers for hairy cell leukemia. Now the next question is about the markers. So the marker which is used for hairy cell leukemia is, so the most important marker is annexin A1. Please remember it, annexin A1 is the marker for hairy cell leukemia, while the annexin 5 is the marker for apoptosis. Please remember it. Here it is annexin A1, while this is extra point that the annexin 5 is a marker for apoptosis. Please remember it. Annexin 5 is a marker for apoptosis, but here the most important marker is annexin A1. Now on the what findings we see on the bone marrow biopsy. So this is my last question, sixth question, that is what finding is seen on the bone marrow biopsy. So the finding we see on the bone marrow biopsy is fried egg appearance. Please remember it, fried egg appearance is seen in the hairy cell leukemia on the bone marrow biopsy. Now let's move to the images what we see. So here as we see that hairy cell, hair-like projections were coming out from the cell. So it is a hairy cell, cells were seen. So on the microscopic image we see the hairy cells. Hairy cells were seen on the microscopic image. Now on the phase contrast microscopy also we see. So this is a phase contrast microscopy. So this is a phase contrast microscopy. Also we find the hairy cell projections were coming out, and in this image we see that it looks like a fried egg appearance. So it looks like a fried egg appearance. So fried egg appearance is seen in the hairy cell leukemia. So this is all about the hairy cell leukemia. Now I am going to tell you some important questions which were very important. So can you also tell me where else we find the fried egg appearance? So here is one table that fried egg appearance is seen in the hairy cell leukemia, in the brain tumor that is oligodendroglioma, that is oligodendroglioma, and in the mycoplasma also we see the hairy cell fried egg appearance. Mycoplasma also we see the fried egg appearance. So this is one table about the fried egg appearance. Now the second table is about that all lymphomas were involve the white pulp of spleen, while the except, so there is one exception. So all lymphomas involve the white pulp of the spleen, while the hairy cell leukemia involves the red pulp of spleen. Please remember it, that the hairy cell leukemia involves the red pulp of spleen. So this is a very important question, that hairy cell leukemia hairy cell leukemia involve the red pulp of the spleen. Now, so these all were findings of the hairy cell leukemia. It is very important topic, that in the hairy cell leukemia it is mostly involved in the males, as males were much worried about their hair. So males, most common gender involvement is males in hairy cell leukemia. Mutation is BRAF V600E mutation is there. In the spleen there is splenomegaly is finding, and on the microscopic image we find the hairy cells, and phase contrast microscopy is also done. The special stain used for hairy cell leukemia is TRAP stain, that is tartrate resistance acid phosphatase. Marker is annexin avian, while for the annexin 5 the marker is it is marker for apoptosis. On the bone marrow biopsy we find the fried egg appearance. So all these questions are very important about the B type of non-Hodgkin lymphoma. So in the next video I am going to cover the T type of non-Hodgkin lymphoma. I hope you get some benefit of this video. Thank you. Bye bye guys.